I want to seize the time as possible, so that's my motivation. I don't want to waste any time. I graduated on time. I took the board exam as soon as possible.
Hello, dentistry.
Hello, Southwestern University Finland.
Good day.
Hello, Claude. It's been 2 years stuck online, right? Long time no see.
Yes, Donna. Pandemic really took a toll on us, especially our students. But we're happy to announce that face-to-face classes are back on track.
So that means face-to-face interviews are now allowed.
Speaking of interviews, we invited someone to join us today. Like us, he was also once in our position.
What do you mean? Was he a student?
Not only was a student, but a SWUDENTISTA.
Was he the only student who graduated from his batch on time?
He did not just finish on time, but he was also awarded with Latin honors.
Wow! I think I heard he's now working as a clinical instructor here in Southwestern University Finland.
All that while also working in a family-owned dental clinic.
Oh, fresh grad with Latin honors, clinical instructor, then that's up their clinic. How did he do it?
And that's what we're gonna find out today.
I was closing all the blinds just so you could sleep the night through.
Let me introduce to you our very own Dr. Jhudiel Pelesco.
Hey. Hi, Doc. I heard a lot of interesting things about you, and I'm very curious and I'm interested in learning how you achieve all of it. Prayer reveal naman, Doc.
So, okay, typical question. Doc, as a dental graduate, what made you choose the dental profession among other careers in the healthcare fields?
First, I will begin when I was on nursery. No, I always see my mom treating patients, and her patients were very happy, were very satisfied, and that kind of feeling, I want also to have that kind of feeling. I'm giving them quality smiles, beautiful smiles. So someday I also told myself when I was a kid na pohon mag-dentista po. It's like that.
So, Doc, it's an established fact that dentistry is not a walk in the park course. What are your driving factors to finish dentistry and become a dentist?
I really wanted to help my mom, and by help I really want na as soon as I can, because of course we all know here our parents are not getting younger, and we never know the day-to-day basis in our activities, what will happen next. So I want to seize the time as possible. So that's my motivation. No, I don't want to waste any time. So on that aspect, I was successful because I graduated on time, and I took the board exam as soon as possible. So now I'm helping my mom, and also I'm imparting my knowledge to my students through being a teacher.
So, after finishing dentistry, what was your biggest takeaway or life lesson?
First is time management is everything. And failure doesn't define what you're capable of. You've been asked with your teachers to repeat several times in your resto. You've been asked with your teachers like me, of course, kanina, nakita niyo, I've asked them to repeat on RPD. But that doesn't mean nabugo sila. That doesn't mean they don't know. I just wanted to let them know that they can do more than that. They are capable of doing better. And because on the board exam, we want to exert the best version in our learnings, diba? Especially on practical side. So, and part of that is committing failures, committing mistakes. And if you commit several mistakes, several failures, that's okay as long as you don't give up on your dreams. Because failures doesn't make you less of a person. At the end of the day, the person who fails more learns more. Diba?
As a fresh graduate dentist, what's the biggest struggle you've encountered so far?
Managing my time, being a clinician, being maintaining my grade, and also being an officer on clinicians club on our term. I was the president, so I need to juggle up. I need to maintain the pacing so that I can comply my requirements on time. I need to have a passing grade, or if it's good, more than that. And I need to satisfy my fellow clinicians and my teachers as me being a leader in the clinicians club organization. So it's hard to mix all of those on that moment, especially we were having face-to-face setup. You need to cater the patients, their clinical requirements, resto, FPD, endosurgery. Plus you need to study for the exams next. And next you need to assist the need of the clinicians that there are inquiries about the clinics. So you need to set a line on which first you need to take, which is more important. Then you need to prioritize. Okay, prioritize. Because if you will lapse on one thing, then it will become like a domino effect.
Did you feel, or do you feel like your patients trust you less because you're younger than other dentists?
I think no, because I know in myself that as a graduate in Southwestern, I'm competent enough. And if you trust yourself, your patient can feel that also, that the dentist trusts his capability. So the patient will trust you also, okay? Despite that, there is comparison between the practice of my mom and me, and my mom is practicing more than 25 years already as a dentist. There will always be a gap. But in the matter of trust, you need first to trust yourself. Then you can gain the trust of your patient. So in my case, I trust myself because graduate soon you will be a graduate here. You will become dentist from Southwestern University Sigma. The learnings you have, the acquired dexterity, experiences, those components or factors will help you trust yourself. You are the best version of yourself, the best that you can be.
How do you persuade difficult patients to trust you and your dental recommendations?
I don't really persuade. I just present all the facts. All dental treatments has pros and cons. Okay, so I really don't persuade, but I will present the most ideal treatment, the best way that I can, so that the patient will realize that this ideal treatment is best suited for him or for her. So in that manner, he can realize na, dili na lang ko doc because this is the best way. So I will let the patient realize by presenting all the facts na lang sa mga treatment na pwede. Because there are many ways to kill a cat. So the same way, there are many approaches for different cases. So, but among those approaches, there is an ideal one. So you need to present well to the patient the pros and cons of the different treatment plans.
What if, Doc, kanang mo disagree sila, and so sa imong dental opinion, and how did you handle this?
They will disagree with my dental opinion, or example, if I'm presenting him the best treatment plan for him or for her, and he wanted this way, the other way around. So of course, I cannot really push the patient to go in my decision, no? Go along with my decision. So, how to handle that? Number one, you need to acquire consent. No, you need to acquire consent that you've educated the patient in all means possible. So, number two, that you need to let the patient sign that he or she already knows the consequences of the decision he or she will be making. You will be protecting yourself, and you will be satisfying the patient's wants. It's not his needs anymore because it's what he wants, and you know what he needs, diba? There's a difference between the two. So you need to sign that you already satisfy what he or she wants.
So Doc, how about patients who ask for discounts, especially to people who are close to like your family, distant relatives, friends, and the like?
Actually, I give discount. Actually, I don't mind discount as long as it's still profitable in our practice. Because diba, when we took up dentistry, I don't know that to some of you, when I took up dentistry, I always wanted to say, I want to help people. Wala jima, wako ni ana first na gusto ko madato. Kay if you want to be kanang rich, then you go with business courses. Diba? Ana.
Doc, we are aware that establishing a private practice is very expensive. What other career options can you recommend to those who still have saving to afford a practice?
You become associate dentist. You don't need capital for that. You just need to work in a dental clinic. You render dental services to your patient. Then you will receive profit from the dentist who owns the clinic. If you need to save that, then you can build your own clinic. That is also a good way why you can observe how the dentist who owns the clinic manage his or her clinic. So once you can save enough, you will own the dentist. You can modify your plans. So my previous dentist I'm working at managed this way. Can I do a better approach? What mistakes did he commit? What errors did he plan out? So I can modify it so that I will avoid in my practice.
As someone who is still building a name in the field, have you thought of ways on how to attract more patients?
That's a very good question. No? People say go with marketing, posting Facebook and posting in Instagram. Actually, there's for me, guys, the best way you can get your gather more patients, no, or attract patients to your clinic, is giving the existing patient that you have the best way you can, and they will reto na.
Word of mouth.
Because experience is the best marketing, no? The patient, example, you are the patient, and this patient doesn't know me, and I'm giving you the best way that I can, or giving you the best dental service, being competent, no? And you will tell to her, kanina dentist, try me, and she will experience it the same way like you do. So it will just branch out. There's no need to market your practice if you are competent enough.
Doc, we know that you are quite busy as a dentist and as a clinical instructor at the same time. How do you balance your obligations at work, at home, and elsewhere?
That's a hard question because I'm still on the adjusting part because kaka-pass ko lang and the clinic, I'm working in the clinic in my mom and there are a lot of patients food, no? And between that, I also need to teach here and also I have my responsibilities at my home. So I really don't know how to answer that exactly at karon because I'm still adjustment. But so far, balancing, you just need to render the time for your clinic. Yeah, prioritize, like what I said a while ago. No, prioritize. Okay. So if the clinic I'm working with needs more in my presence, then I'll go with it. Then if it's my responsibility to teach na, then I'll go in that one. Go with the flow lang kung saan ka need. Okay? Because basta at the end of the day, you give time to yourself. Okay? That's also applicable to you as students. It's very hard. I know clinicians na mo I assume. Between the clinical works, the online class, the exams, and I know some of you have jowas already, so love life, so that's very hard to balance. But you can balance that, guys. Find a way. Basta at the end of the day, give time to yourself. Diyan naman tayo ma-crazy if we give more time to others than ourselves, di ba?
And lastly, Doc, as someone who finished dentistry strong, what advice can you give to struggling dentistry students?
Never be afraid to commit errors or failures. It's part of our journey. It will always be part, and be proud of it. Kaya that failure will give you a lifetime experience or lesson. Alright.
That was it, Doc. Thank you for giving us your time.
Yes,
Your
welcome.
busy schedule.
And we hope that just like you, we finish dentistry with flying colors.
Flying
Yes,
colors.
we have.
Thank
you.
Thank you, Doc.
That was it, guys. A time with Dr. Jhudiel Pelesco.
We hope that just like us, you learned something. So remember to stay curious and keep learning. Thank you for staying with us.